Welcome to our channel, where healing meets wisdom. In this journey, we explore powerful practices, ancient teachings, and modern insights that nurture your body, mind, and soul. Whether you're seeking inner peace, emotional clarity, or spiritual growth, you're in the right place. Each video is crafted to inspire reflection, encourage transformation, and support your path to wholeness. From guided meditations to timeless philosophies, we're here to walk with you through life's challenges and triumphs. Don't forget to subscribe and join a community rooted in compassion, growth, and truth. Let's begin this healing journey together with wisdom and heart. Healing and wisdom. Healing and wisdom are two of the most profound concepts in human existence. While healing is often associated with recovering from physical, emotional, or spiritual wounds, wisdom is generally understood as deep insight, good judgment, and the ability to apply knowledge meaningfully. Both are essential for a balanced and fulfilling life. Though different in nature, healing and wisdom frequently intersect. Healing often requires wisdom, and wisdom often arises from the experience of healing. This essay explores the definitions, dimensions, and interconnections of healing and wisdom, drawing from philosophical, psychological, spiritual, and cultural perspectives. Defining healing. Healing refers to the process of becoming sound or healthy again. While traditionally linked to physical recovery, healing also encompasses emotional, psychological, and spiritual restoration. It's not merely the absence of illness, but the presence of well-being, balance, and peace. There are various dimensions of healing. Physical healing involves the body's recovery from injury, disease, or illness. This is usually assisted by medical intervention, rest, and time. Emotional healing, the process of coming to terms with painful emotions and finding peace or closure. Psychological healing deals with mental health and may involve therapy, self-awareness, or behavioral change. Spiritual healing involves a reconnection with meaning, purpose, or the divine, often after a crisis of faith or identity. Healing is not always about curing. Sometimes, especially in chronic conditions or terminal illness, healing can mean acceptance, comfort, and peace rather than full recovery. Defining wisdom. Wisdom is the ability to make sound judgments and decisions based on knowledge, experience, and deep understanding. It is often associated with age, maturity, and life experience, but one need not be old to be wise. There are several characteristics of wisdom. Knowledge. A wise person understands facts, ideas, and principles. Perspective. The capacity to see the bigger picture and long-term consequences. Empathy. Wisdom involves understanding others and being compassionate. Reflection. Wise individuals are introspective and capable of learning from past experiences. Balance. Wisdom seeks a middle path, avoiding extremes. Philosopher Nicholas Maxwell distinguishes between knowledge inquiry, facts, and wisdom inquiry, understanding how knowledge should be applied to achieve a better world. The interconnection between healing and wisdom. Though they may seem unrelated, healing and wisdom are deeply interconnected in multiple ways. Wisdom through healing. People often gain wisdom through the process of healing. Surviving trauma, illness, or loss can lead to greater self-awareness, emotional intelligence, and empathy. For example, someone who overcomes depression might later guide others through similar struggles, using their experience to offer real understanding and insight. Healing through wisdom. Conversely, applying wisdom can accelerate healing. Knowing when to seek help, understanding the need for patience, and practicing forgiveness are wise choices that support recovery. A wise person recognizes the importance of letting go, setting boundaries, and choosing positive environments. Spiritual traditions. In many religious and spiritual traditions, healing and wisdom are intertwined. In Christianity, Jesus is both a healer and teacher. In Buddhism, the path to enlightenment is both a healing of ignorance and a cultivation of wisdom. Indigenous healing practices also often involve elders who guide others with wisdom derived from communal and natural knowledge. therapeutic approaches. Modern psychology also bridges the two. Cognitive behavioral therapy, CBT, for example, promotes self-reflection and rational thinking, forms of wisdom that help in emotional healing. Mindfulness practices, rooted in Buddhist wisdom, are now widely used for stress reduction and mental health. Healing as a journey. Healing is not a linear path. It is often unpredictable, with progress and setbacks. It can take months, years, or even a lifetime. But every step, even backward steps, can teach us something important. Consider grief. There is no cure for the loss of a loved one. Instead, healing involves integrating the pain into one's life narrative. People may emerge from grief with deeper gratitude, appreciation of life, and empathy for others. The wisdom that arises from such suffering is often profound. In psychological terms, this is referred to as post-traumatic growth, positive psychological change resulting from the struggle with challenging life circumstances. The individual not only recovers but grows in insight, appreciation, and spiritual depth. Wisdom as lived experience. Unlike intelligence, which is primarily cognitive, wisdom includes emotion, morality, and intuition. It's not about knowing everything, but understanding enough to act rightly in complex situations. Wisdom often emerges from lived experience, particularly from difficult or painful experiences. This is why wise people are often those who have suffered and healed. They carry scars not as symbols of weakness, but of survival and transformation. A wise person may not always have the right answer, but understands how to live with ambiguity, accept uncertainty, and choose kindness over correctness. They know that healing can't be forced and that patience is a powerful ally. Cultural and historical perspectives. Across cultures, healing and wisdom are closely related. Ancient Greece, the Greeks saw healing as connected to the gods. Asclepius, the god of healing, was revered, and sanctuaries were built for holistic recovery, combining medicine, rest, dreams, and rituals. Philosophers like Socrates and Plato linked wisdom with self-knowledge, which is crucial for inner healing. Chinese medicine and Taoism. Healing involves balance of yin and yang, of body and spirit. Wisdom lies in harmony with the Tao, the Way, which teaches that forcing outcomes leads to suffering. Healing happens when we align ourselves with the natural flow of life. African traditions. Healers are often the wise elders using herbs, rituals, and spiritual guidance. Wisdom is communal, passed down through storytelling and lived examples. Indigenous cultures, Native American and Aboriginal traditions emphasize the spiritual aspect of healing. Ceremonies often involve storytelling, prayer, and connecting with nature. Healing is not just individual, but collective. Wisdom comes from the ancestors and is expressed through respect for all beings. These traditions show that wisdom and healing are not Western inventions, but universal human values. Modern applications and relevance. In today's fast-paced world, the importance of healing and wisdom is more relevant than ever. Mental health. With rising rates of anxiety, depression, and burnout, the need for emotional healing is critical. Mindfulness, therapy, and community support offer tools for recovery. However, wisdom is needed to discern what works for the individual, to resist toxic productivity, and to prioritize self-care. Social healing. Societies also need healing from war, inequality, racism, and environmental damage. Social healing requires wisdom in leadership, policymaking, and dialogue. It means facing painful histories honestly and building a more just and compassionate future. Personal growth. For individuals, the pursuit of healing and wisdom can lead to a richer, more meaningful life. Whether through journaling, prayer, meditation, or mentorship, people can engage in practices that foster both. Workplace and education. Emotional intelligence, a form of wisdom, is now recognized as essential in leadership and collaboration. Similarly, healing-centered engagement in education helps students grow holistically, not just academically. Barriers to healing and wisdom. Despite their benefits, healing and wisdom are often difficult to attain. Several obstacles can arise. Denial, refusing to acknowledge pain or mistakes, can block healing and prevent growth in wisdom. Pride, sometimes the unwillingness to ask for help impedes recovery. Impatience, in a culture obsessed with instant results, we may rush healing or ignore the slow cultivation of wisdom. Misinformation. In the digital age, access to vast information can be confused with wisdom, though they are not the same. Overcoming these barriers requires humility, perseverance, and community. Cultivating healing and wisdom. Both healing and wisdom can be cultivated. Here are some practices that support both. Journaling. Reflecting on thoughts and emotions helps process pain and develop insight. Therapy or counseling, professional support can guide healing and offer new perspectives. Mindfulness and meditation. These practices develop awareness and inner peace, key to both healing and wise living. Mentorship and dialogue. Learning from others, especially elders or those with different experiences, broadens understanding. Reading philosophy and literature. Stories and ideas can challenge, comfort, and expand our thinking. Time in nature. Being in nature can ground us, heal emotional wounds, and restore perspective. Healing and wisdom are twin paths in the human journey. Though different, they often grow from the same soil of experience, reflection, and compassion. Healing restores us, while wisdom guides us. Healing soothes the wounds of the past, while wisdom lights the way forward. Together, they create resilient, thoughtful, and compassionate individuals capable of transforming themselves and the world around them. To pursue healing and wisdom is not to escape pain, but to face it with courage, learn from it, and use it to grow. In doing so, we honor our humanity and contribute to the greater good. Physical healing, a comprehensive exploration. Physical healing is the body's natural and remarkable process of repairing itself after injury, illness, or trauma. It involves complex biological and physiological mechanisms aimed at restoring the structure and function of damaged tissues. From a simple paper cut to major surgery or broken bones, physical healing is essential to survival and overall health. In this essay, we'll explore the processes, stages, types, and factors influencing physical healing, as well as modern medical interventions and the role of alternative practices. The biology of healing. Physical healing is governed by the body's innate biological mechanisms, designed through evolution to manage injuries efficiently. At the cellular level, it includes inflammation, regeneration, and tissue remodeling. Healing is influenced by numerous factors, including age, nutrition, immune system health, and the presence of chronic diseases. 1. Inflammatory response. The healing process begins almost immediately after injury with inflammation. This initial response is critical for containing damage and preparing tissues for repair. Blood vessels constrict briefly and then dilate, allowing immune cells like neutrophils and macrophages to flood the area. These cells remove dead tissue, destroy pathogens, and release signaling molecules known as cytokines to recruit more healing agents. 2. Proliferation and tissue formation. Following the cleanup phase, the body begins to rebuild. Fibroblasts generate collagen and other extracellular matrix proteins to create new tissue scaffolding. Endothelial cells help form new blood vessels, angiogenesis, to supply nutrients and oxygen, while epithelial cells regenerate the skin or tissue lining. In bones, osteoblasts lay down new bone matrix. 3. Remodeling, maturation phase. The final phase of healing involves refining and strengthening the new tissue. Collagen fibers are reorganized and unneeded cells undergo apoptosis, programmed cell death. This phase can last from weeks to months, depending on the extent of the injury. The tissue regains tensile strength, although it rarely returns to its original uninjured state. Types of physical healing. Physical healing is not a one-size-fits-all process. It varies according to the type of tissue involved and the nature of the injury. 1. Wound healing, skin and soft tissue. Skin wound healing is the most widely studied form. It occurs in 4 overlapping stages. Hemostasis, blood clotting to prevent further bleeding. Inflammation, immune response to clear debris and pathogens. Proliferation, tissue regeneration, collagen deposition, and angiogenesis. Remodeling, strengthening and reorganizing the tissue. Minor wounds can heal with minimal scarring, while deeper injuries may require months and result in noticeable scar formation. 2. Bone healing. Bones are unique in that they can heal without forming scar tissue. Bone healing also occurs in stages. Inflammatory phase, hematoma formation and inflammation. Repair phase, formation of soft callus and later a hard callus. Remodeling phase, the bone is reshaped to its original form and strength. Complete healing can take several months depending on age, fracture type, and health status. 3. Muscle healing. Muscles regenerate primarily through activation of satellite cells, muscle stem cells. After injury, these cells multiply, differentiate into muscle fibers, and integrate with existing muscle tissue. However, excessive damage may result in fibrosis, scar tissue, reducing contractile strength. 4. Nerve healing. Unlike other tissues, the nervous system has limited capacity for repair. Peripheral nerves can regenerate if the damage is not severe, but central nervous system injuries, like spinal cord damage, often result in permanent deficits. Advances in neuroregeneration are being researched to overcome these limitations. 5. Organ healing. Different organs have varying abilities to heal. The liver, for instance, has extraordinary regenerative capacity. In contrast, the heart has limited ability to regenerate after injury like a heart attack, often leading to scar tissue and compromised function. Factors influencing physical healing. Healing is not uniform and depends on several internal and external factors. 1. Age. Younger individuals generally heal faster due to more active cellular processes, better circulation, and stronger immune responses. Older adults experience delayed healing, partly due to slower cell turnover and the presence of chronic conditions. 2. Nutrition. Healing is energy-intensive and requires adequate nutrients, especially protein for cell repair and collagen formation, vitamin C for collagen synthesis, vitamin A for cell proliferation, zinc for enzyme function and immune support. Malnutrition severely impairs all stages of healing. 3. Chronic diseases. Conditions like diabetes, cardiovascular disease, or autoimmune disorders impede healing by disrupting circulation, immune function, or cell metabolism. 4. Smoking and alcohol. Nicotine constricts blood vessels, limiting oxygen delivery. Alcohol impairs immune function and protein synthesis. Both contribute to poor healing outcomes. 5. Infections. Bacterial contamination can derail the healing process, prolong inflammation, and lead to chronic wounds. Antibiotic therapy and proper wound care are crucial in such cases. 6. Stress and sleep. Chronic stress and poor sleep disrupt hormone balance, like cortisol and immune function, delaying healing. Medical interventions in healing. Medicine plays a critical role in enhancing or facilitating healing when natural processes fall short. 1. Surgical repairs. In cases like deep wounds, broken bones, or organ damage, surgical interventions can stabilize injuries, remove dead tissue, and ensure proper alignment for healing. 2. Medications. Antibiotics prevent or treat infections. Anti-inflammatories reduce excessive inflammation, though excessive use may impair healing. Growth factors. Some synthetic growth factors are used to accelerate healing in certain contexts, such as diabetic ulcers. 3. Physical therapy. After musculoskeletal injuries or surgery, physical therapy is essential to regain strength, flexibility, and function. It promotes blood flow and prevents atrophy. 4. Wound care technologies. Advanced wound dressings, negative pressure wound therapy, and hyperbaric oxygen therapy can accelerate healing, especially in chronic or non-healing wounds. Alternative and complementary approaches. Many people turn to traditional or alternative medicine to support physical healing. Though not replacements for medical treatment, some have shown promise. 1. Herbal remedies. Herbs like aloe vera, turmeric, and gotu kola have been used to support wound healing. They have anti-inflammatory, antioxidant, and antimicrobial properties. 2. Acupuncture. Acupuncture may support healing by increasing blood flow, modulating inflammation, and relieving pain, though more robust clinical evidence is needed. 3. Massage therapy. Massage helps increase circulation and reduce muscle tension, potentially supporting recovery in soft tissue injuries. 4. Nerve healing. Unlike other tissues, the nervous system has limited capacity for repair. Peripheral nerves can regenerate if the damage is not severe, but central nervous system injuries, like spinal cord damage, often result in permanent deficits. Advances in neuroregeneration are being researched to overcome these limitations. 5. Organ healing. Different organs have varying abilities to heal. The liver, for instance, has extraordinary regenerative capacity. In contrast, the heart has limited ability to regenerate after injury like a heart attack, often leading to scar tissue and compromised function. Factors influencing physical healing. Healing is not uniform and depends on several internal and external factors. 1. Age. Younger individuals generally heal faster due to more active cellular processes, better circulation, and stronger immune responses. Older adults experience delayed healing, partly due to slower cell turnover and the presence of chronic conditions. 2. Nutrition. Healing is energy-intensive and requires adequate nutrients, especially protein for cell repair and collagen formation, vitamin C for collagen synthesis, vitamin A for cell proliferation, zinc for enzyme function and immune support. Malnutrition severely impairs all stages of healing. 3. Chronic diseases. Conditions like diabetes, cardiovascular disease, or autoimmune disorders impede healing by disrupting circulation, immune function, or cell metabolism. 4. Smoking and alcohol. Nicotine constricts blood vessels, limiting oxygen delivery. Alcohol impairs immune function and protein synthesis. Both contribute to poor healing outcomes. 5. Infections. Bacterial contamination can derail the healing process, prolong inflammation, and lead to chronic wounds. Antibiotic therapy and proper wound care are crucial in such cases. 6. Stress and sleep. Chronic stress and poor sleep disrupt hormone balance, like cortisol, and immune function, delaying healing. Medical interventions in healing. Medicine plays a critical role in enhancing or facilitating healing when natural processes fall short. 1. Surgical repairs. In cases like deep wounds, broken bones, or organ damage, surgical interventions can stabilize injuries, remove dead tissue, and ensure proper alignment for healing. 2. Medications. Antibiotics prevent or treat infections. Anti-inflammatories reduce excessive inflammation, though excessive use may impair healing. Growth factors. Some synthetic growth factors are used to accelerate healing in certain contexts, such as diabetic ulcers. 3. Physical therapy. After musculoskeletal injuries or surgery, physical therapy is essential to regain strength, flexibility, and function. It promotes blood flow and prevents atrophy. 4. Wound care technologies. Advanced wound dressings, negative pressure wound therapy, and hyperbaric oxygen therapy can accelerate healing, especially in chronic or non-healing wounds. Alternative and complementary approaches. Many people turn to traditional or alternative medicine to support physical healing. Though not replacements for medical treatment, some have shown promise. 1. Herbal remedies. Herbs like aloe vera, turmeric, and gotu kola have been used to support wound healing. They have anti-inflammatory, antioxidant, and antimicrobial properties. 2. Acupuncture. Acupuncture may support healing by increasing blood flow, modulating inflammation, and relieving pain, though more robust clinical evidence is needed. 3. Massage therapy. Massage helps increase circulation and reduce muscle tension, potentially supporting recovery in soft tissue injuries. 4. Energy healing practices. Modalities such as Reiki or therapeutic touch are believed by practitioners to facilitate healing by balancing the body's energy. While scientific support is limited, some patients report improved well-being and stress reduction. Chronic wounds and healing disorders. Not all wounds heal properly. Chronic wounds are those that fail to progress through normal healing stages. 1. Common types. Diabetic foot ulcers, venous leg ulcers, pressure sores, bed sores. These require specialized treatment due to persistent inflammation, poor circulation, and often infection. 2. Healing deficiencies. Genetic conditions or immune disorders can impair healing. For example, people with Ehlers-Danlos syndrome have connective tissue abnormalities that delay wound closure. The future of physical healing. Science is rapidly advancing new ways to support and enhance healing, often using cutting-edge biotechnology. 1. Stem cell therapy. Stem cells can differentiate into various tissue types, offering potential to regenerate damaged organs and tissues. Research is ongoing in areas like spinal cord injuries, heart repair, and joint regeneration. 2. Tissue engineering. Using 3D printing and scaffolds seeded with cells, scientists aim to create artificial tissues and organs for transplantation and repair. 3. Genetic engineering. By altering genes that influence healing, e.g., those involved in inflammation or growth factor production, researchers hope to accelerate and improve the healing process. 4. Wearable and smart technologies. Devices that monitor wound healing in real time or deliver drugs directly to injury sites are becoming more common. These technologies can prevent complications and customize treatment. Physical healing is an intricate, multi-stage process that reflects the body's remarkable ability to restore itself. From cellular repair to tissue remodeling, healing is influenced by a wide range of biological, environmental, and lifestyle factors. While the body has a powerful innate capacity to heal, modern medicine and technology enhance outcomes, especially when natural healing is impaired. Complementary approaches may further support recovery, though they must be used judiciously. As research progresses, especially in stem cell therapy, tissue engineering, and gene editing, the future of physical healing holds incredible promise. Ultimately, understanding and supporting this vital process is key to promoting health, recovery, and quality of life. Thanks for watching. If you found healing or wisdom in today's video, remember to take a moment to breathe, reflect, and carry that peace with you. Life is a journey, and every step toward growth matters. Don't forget to like, share, and subscribe for more insights and uplifting content. Drop your thoughts in the comments. I'd love to hear your story or what resonated most. Keep nurturing your mind, body, and spirit. Until next time, stay grounded, stay open, and remember, healing isn't linear, but every moment of awareness brings you closer to your true self. Take care and be well.